welcome Dr. Brian Lanier with New Hanover Regional Medical Center's Coastal Family Medicine Clinic with us today. And Dr. Lanier here to talk about something that I don't know a lot about, maybe you don't know as well, sudden infant death syndrome. It is called SIDS, and unfortunately it causes thousands of deaths every year. Brian, thanks for coming in today.
Thank you.
What is the reason, what causes SIDS? It's one of those things that people have heard of, but maybe just not really knowledgeable about.
Right. So SIDS is defined as the sudden and unexpected death of an infant or a child less than 1 year old for reasons that, while sleeping, that can't be explained by other reasons after a thorough investigation. And the cause of it is not really clear. It's thought that a child might be predisposed to SIDS by having some abnormalities in the brainstem coupled with a critical stage in their development and then being in a stressful sleeping environment. The incidence of SIDS peaks between 1 and 3 years old, 1 and 3 months old, and it goes down after that. And it's thought that probably by about 8 months of life, kids are out of the woods for the risk.
And I've heard so many people say they're really concerned when they put the child like in a crib or a bassinet, something like that, because they are afraid of this, because that's when some of these instances have occurred, and they are always trying to relate that to a sleeping position. Is that part of a risk problem?
So in 1992, the American Academy of Pediatrics recommended that kids be put to sleep on their back, and then 2 years later they came out with a Back to Sleep campaign to get the word out about that recommendation.
And quickly, how can it be prevented? I don't want to run out of time without getting that in.
So after that, the incidence of SIDS went down by 56%. So we know that putting kids to sleep on their back is extraordinarily important. Not sharing beds with adults is extremely important, particularly in the first 12 weeks of life, but certainly throughout the first year of life. Not being exposed to cigarette smoke, both in utero and after they're born, will reduce the risk. Children that are breastfed, their risk is reduced down to 1/3 of that for non-breastfed children.
So it's all good advice, and a lot of it's common sense advice.
That's right. Well, most of it is. Another important thing is that kids should go to sleep on a firm mattress with only a tight-fitting sheet. They don't need blankets, toys, bumpers. They just need to be dressed warmly. And the maternal instinct to cover a baby with a blanket is very strong, and they really don't need those fluffy things inside the crib with them.
All right. Brian, thanks very much. It's a subject that nobody wants to have to go through with their family, but thanks for coming and sharing some information.
Good.
All right.
Thanks for having me.
More on Fox Wilmington coming up in just a couple of minutes, and the Live Alert Center will tell you about the story coming up in just a moment.